Today we're going to be talking about handling information in care settings for the Level 2 Adult Care Diploma. The first thing we're going to talk about is understanding the need for secure handling of information in care settings. And our first question on that topic is identifying the legislation that relates to recording, storage, and sharing of information. So this is not an exhaustive list. It doesn't cover everything. There's a few more. But the main ones you'd want to think about are the Data Protection Act is definitely the main one. This is the main piece of legislation at the moment that regulates how we process and share information. There was originally in the Data Protection Act 1998. It was updated in 2018 to comply with the GDPR, General Data Protection Regulations across the EU, which makes sharing and processing of information, it means it's working along the same rules across the EU, which means that you can transfer information between the countries without worrying about the rules being different or you being in breach of the regulations or the law in that case. So that is convenient in that way. For us, it lays out what the rules are. The Freedom of Information Act is another key piece of legislation that relates to handling information. This law is the one that allows individuals to request certain types of information that's held on them by public authorities. This means information that's held by the government, local authorities, hospitals, GPs, or the police forces. It doesn't apply to private companies or other organizations. So it's just the public bodies where have you have what's called freedom of information requests. Another one is the Human Rights Act. One of the articles of the Human Rights Act is the right to private and family life. So we all have a human right to privacy. We also have the Mental Capacity Act and the Mental Health Act. Both of these have allowances for certain situations where you have to share information in the best interest of the individual. I haven't mentioned actually on the slides the Terrorism Act. That is the one that says that if you have a concern that somebody is getting into extremism and might be a risk that way, that you have a duty to report it. I would recommend completing PREVENT training. You can find that online. And it will help you understand a bit more about that and how you can actually help people in these situations. In general, you would not confront the individual, you would report it through your safeguarding processes. Okay, next question. Why is it important to have secure systems for recording and storing information in care? And the answer is it is vital. First of all, for trust. People are giving us a lot of information. They allow us into their homes, or when they might come to a care home or any other care setting. They give a lot of information. The basics, name, age, date of birth, phone numbers, emails, that's all personal information, along with health information, along with the difficulties that they're facing and what they need support with. This is all very private and personal information that people would not like to be just shared with anyone. If it is shared with anyone, there could be a massive loss of trust. Think about how you'd feel if someone was sharing your information. You wouldn't be happy. For instance, it's okay because it was my mum, but my bank just gave out my bank balance to my mum. They didn't ask for any ID, they just gave it to her. I wasn't there, I hadn't agreed to it or anything. I was a little put out over it. It's okay because it is my mum, but I was a little concerned. Slight loss of, well, probably a big loss of trust there, to be honest. That's one example. Um, Other examples are of why it's important are privacy, rights, and choice. They go together very well. Again, we're thinking about the Human Rights Act. We're thinking about the Mental Capacity Act. We're thinking about the Equality Act. People have a right to choice. They have a right to be treated fairly and equally and not to be discriminated against. If we are, let's say, not storing the information securely, then we can be breaching people's rights. The right to privacy is a fundamental human right, really. And finally, I've put down vulnerability to abuse, fraud, or discrimination. If somebody's private medical information, for example, which would be a common thing for us to hold in care settings, we need to know how to support people, we need to know about their needs, therefore we'd have some medical and other information. This could leave people vulnerable to abuse or fraud. Let's say if somebody has dementia and that's on their records with their names and addresses, and if that became somehow got out there into the wrong hands, that could lead someone to be vulnerable. Let's say to somebody coming around to the door, and they could be vulnerable to scams, let's say. So it's really important that we have secure systems, um, filing systems, lockable filing systems, and password and firewall protected computer systems to make sure people stay safe. Okay, another question. This is actually under the criteria. Just tell you the proper criteria. Know how to access support for handling information. So the question is, describe how to access guidance, information, and advice about handling information. You have quite a few options. Got your usual option, talking to your line manager. They are going to be the best people to give you advice and clarify situations for you based on your company's policies and procedures and what's going to be right for you. You also have the option to read your company's policies and procedures yourself. I'd recommend it in general to have a look through your policies and procedures and know where everything is if you do need to check it. You can also read the relevant legislation yourself or the codes of practice. Might be a bit long. You might just want to read the summaries to have an idea of what's there, but you do have the option to read the legislation yourself. Codes of practice you might want to have a look at might include the Caldecott reviews. They were detailed reviews on information handling practices in care settings. Other options to clarify something maybe quickly would be to talk to a senior colleague, a team leader who will be able to tell you the answer, and attending training. You can attend training specifically on data protection and information handling, and that might be useful to you. It might be something you want to consider. Okay, your last question is, what action should you take when there are concerns over the recording, storing, or sharing of information? Now, these kind of concerns might be maybe you heard some colleagues talking in the hallway or talking in the cafe down the road about a service user, and maybe it's sensitive information. Any information about a service user is really sensitive information. If it's just saying what that service user got up to during the day, that's still that service user's information, and they expect privacy from us. So they don't want anyone else, especially down the cafe. You wouldn't know who's listening. So that would be one concern. Other concerns might be that you are holding too much information, that you're holding it too long, that you don't have it held securely, that it is the cupboard doesn't lock where you're meant to put the daily living records, or that firewalls aren't that secure on the computers. These are all possible concerns. Hopefully they never come up, but they are something that we should be aware of. Or with sharing of information, it might be a concern that somebody has requested information. It might happen that you get a call to the care home or your care setting, and somebody is claiming to be a service user's social worker or something and asking for information about them. We can never just give out information about them, however professional the person on the phone sounds. We can't risk it. So in those situations, you're going to want to clarify what the issue is. If you think that would be one thing for the last question. If you got that type of call and you weren't sure, ask your line manager, check the policies. If something came up and maybe information was shared and you think it shouldn't have been, or you're just not sure, then your options are report it to the line manager immediately, verbally, email, however you do it as soon as possible, report to your line manager. There might be a form to fill out. In general, report it verbally and your manager can tell you if there's a form to fill out. If nothing's done, if you have reported it verbally and your concern continues and nothing's done, certainly put it in writing. If it's something small that you can take care of yourself immediately, like let's say a service user's records or papers or something is left out on a desk, tidy them up, put them in their file, put them away. Report it to the manager still. Records shouldn't just be left out on the desk. Other than that, you could follow your safeguarding procedures. Again, it is part of it. You are protecting service users who may be vulnerable, and you are protecting their rights. So you would follow safeguarding procedures, and in this case, report to your line manager as soon as possible. Okay, so that is handling information in care settings. I hope that's been helpful. Thank you very much.